So one of the things we both do during our eyelid consultations is talk about the eyebrows, and that's often a surprise to most of our patients, I think. So can you explain why we talk about eyebrows when we're talking about eyelids?
Yes, and it is a surprise to many people, but it's because upper eyelids and eyebrows are very intricately linked. There are a series of fine muscles above and below the eyebrow that control the eyebrow position, the eyelid position, how wide awake your eye looks, how well you open and close it. So you often have aging of both components simultaneously, and if you only correct one, not only have you not corrected the other, so you don't get quite as good a result, you've also altered the balance between the upper eyelid and the eyebrow. And most frequently, it's the upper eyelid that's done without the eyebrow, and the eyebrow actually moves down and doesn't help the upper eyelid result.
Yeah, and that's exactly the term, the technical term is compensated brow ptosis, which is a bit of a mouthful. But what tends to happen is because everything droops as we get older, including our eyebrows, our brains are very clever, and they make us lift our eyebrows, or many of us, and I know I'm one of them, lift our eyebrows to alleviate that heaviness. And therefore, as you say, once we relieve the extra weight of the eyelid, the brain doesn't need to do so much work, and often the brow comes down.
Yeah. And actually, I find in consultations, showing patients a video of that happening before and after, or with a patient opening and closing their eyes, can be very helpful because it's not obvious otherwise.
Yeah, because we don't see ourselves
Yes.
with our eyes closed.
Exactly.